I'm going to be talking to you about understanding ageing. So what happens to you in your skin, in your body as you start to age. And we all know some people are just genetically gifted and lucky them. Some of us, there are other things that we have to work on to help to improve our health, so our skin health and our body health. And there comes a point in time where, I don't know if you felt it, but I certainly did, where I was going through the perimenopause, and you just look in the mirror one day and you think, oh, who's that person looking back at me? What happened? Yesterday I thought I looked fine, and today not so good. And just suddenly you start to notice these changes in yourself, in your face and in your body, and you see bulges where perhaps there weren't bulges before. So in order to explain why this happens and why it kind of creeps up on your body but you suddenly notice it, is there are changes that are going on in your skin. There are changes that are going on beneath your skin, and I'm going to take you through all of those different things to try and explain why this happens and what we can do about it. So if you look at this slide, you can see healthy skin here, and you can see that it's nicely organised. You've got a nice top layer of the epidermis, all the cells are nicely organised. You've got a great layer here in the dermis of your collagen, and it's nice, your skin's bouncy, and underneath that you've got your fat cells as well, so you've got a nice layer of fat underneath there. So if you imagine this healthy skin is like a really nice big blown up balloon, and it's great and it's healthy and there's no wrinkles on it. We do lose collagen as we get older, so from the age of 20 we're losing about 1% of our collagen per annum. But during the perimenopause, and I'm glad these figures correlate with your talk. So exactly the same figures we're quoting. So we lose as much as 30% of our collagen during the perimenopause. And what happens? So what happens is our aging skin starts to change. So we'll start to notice a little bit more dryness on the surface of the skin, and we'll start to notice a bit of crepiness with that. Underneath that, and the next layer of your skin, you're actually noticing some of the cells are actually separating there. So you can see that separation and that hydration loss that's going on. And you'll experience that yourself as you get a little bit older. But also what's happening with that separation is you're allowing some of the melanocytes, so those are the pigment cells, to come and creep through. So where previously you may have had nice, fresh, even tone to your skin, you start to notice blotchiness and changes and pigments in certain areas. And that's due to that change there. And then underneath that, where we've got our collagen, because we've lost collagen, we're getting some separation of those fibres, and we're not producing as much collagen as we used to. And there comes a point in time where it starts to get quite difficult to produce more collagen. And then just to top it all, underneath that, then the fat cells start to become less as well. So we're losing some of that fatty layer. So all of those things contribute to our skin changing. So aside from the skin surface changing, there are other changes that are going on. So our bone structure changes. So over a period of time, from our 30s onwards, there's changes in our facial bones. There's changes in our bones everywhere, but particularly in the face, things change. So around the eye area, you'll notice here, you've got nice structure of the bone there, but it starts to retract a little bit, so you've got less bone here. And you also start to lose it here in the mandibular area too. And some of you may have noticed as you get a little bit older, your teeth start to change position a little bit. And where they did look fantastic, they start to move a little. And that's all because the bony structures are changing. And a lot of ladies in their 50s are starting to actually go back to the orthodontics. They're looking at Invisalign and helping to support their tooth structure. So it's all related to that bony change. And that's all contributing to how our faces change as we get older. And then, as if that wasn't enough, the fat layers are changing as well. So in our 30s, we've got nice fat padding underneath our skin, so it gives us that plumpness. So whether you're thin, whether you've got more weight on you, you've still got that nice plumpness in your face. But as you get through into your 40s and then your 50s, you start to lose some of those fat pads. So you can see it's starting to go there and it's starting to go there. But what you'll notice actually in that last one, 50 plus, rather annoyingly, the other ones are going, but these ones still stay the same. So you've got the laxity in your skin, so it's not holding things as tightly as it was before, but then you've got these fat pads here that are still there. So they draw down, so they're pulling down. So that's where you get a little bit more of jowliness. And if I could have a penny for every time a patient comes in and says, I just want this, you know, just this. And I'm sure all of us have done it. And you sit and you look in the mirror and you just go, just that, and it would be perfect. So that's all we want. It's very simple, but this is what's contributing to that kind of effect. So what we see on the outside, knowing all of that going on with our skin and the bones and the fat, is this gradual change. And actually, you know, this lady's aged beautifully and very elegant, but what you can notice is the changes gradually occurring externally. So this is why we start to see these changes. You can see just in that area there, you can see some changes in the neck. And that's all just down to those things that we've just discussed. So the skin, the bones, the fat layers, and obviously our muscles as well are changing. So much as we need to boost the muscles elsewhere in our body, boosting them in your face isn't a bad idea. Facial exercises, although you may feel stupid doing them, can actually help a little bit.